welcome back to Brighter Morning with Bhoe. We are in our final segment now. We had a discussion with Derek Chin, just completed. We had a discussion with Dr. Roger Hussein at the University of the West Indies. And now we are going actually out of Trinidad. Now we are going to out of Trinidad and Tobago to Sheffield in England, and basically talking to the head of the neurology department there. He's a Trinidadian, but he's well ensconced in the hospital system, the National Health Service system in England and the UK. And we want to talk to him a little bit. In the discussion with Roger, we could not avoid Dr. Hussein, we could not avoid the discussion about COVID in the background. In the discussion with Mr. Chin, Derek Chin, we could not avoid COVID. And now we are going to go frontally to discuss how the United Kingdom has been dealing with COVID. Good morning, Dr. Mohan. It's so good to have you.
Good morning. Nice to be on your program. And good afternoon to your UK viewers.
Yes, well, it's afternoon there, but it's morning here, and it's great that we could do this through technology. So, Dr. Mohan, tell me a little bit about what is happening now with COVID in the United Kingdom. I know the Prime Minister in the UK is due to speak soon on the way forward for the United Kingdom. But give me your opinion as a medical practitioner in the hospital system on where the UK is with COVID and what is happening, and what trajectory, what momentum we have within the United Kingdom system.
So in the UK, we are in a very interesting position in that a large amount of the population has been vaccinated, but we are still getting an upspike in the Delta variant. Now, thus far, we've not seen that translate into a large increase in the numbers in hospital or ITU. So we are still on the onward trajectory to start reopening the country on the 19th of July.
Could I ask you something, stop you there? You are saying that you are seeing an increase because of the variant. You're seeing a spike, but these people are not going to ICU, is that correct?
So compared to the first...
It is being contained before you get to that severe situation where you require ICU treatment.
So compared to the first and second waves, there is not a large increase in inpatient admissions at this time. Yes. Now, obviously, we are still very early in this Delta variant peak, but because a large amount of the UK population has been vaccinated, and the vulnerable ones, the elderly, people with comorbidities, and people who are on medical treatment who would make them more vulnerable to COVID, have been vaccinated, we aren't seeing a large number of people coming into hospital because it's mostly the younger people who are fitter and more able to successfully fight off the infection who are being infected at this time.
Okay, so the vaccination has played a role in this to a significant degree.
To a massive degree. The vaccination program in the UK, together with the population's willingness to have vaccines and abide by social distancing measures, have played a humongous role in containing the virus.
How did you get over the challenge of vaccine hesitancy? Did you have it? And first of all, how did you manage that?
Yes, I've actually had my vaccine. I've had 2 doses of the vaccine. My second dose was completed in February. The UK population has not really had a long tradition of vaccine hesitancy.
Okay. So it was a more receptive population.
It certainly is. And
What,
certainly
what
they
is the,
started off the vaccine.
what is the percentage of vaccination now, you think?
So I think at first doses, we are almost up to 70%. At second doses, we are certainly close to 60%, if not over.
And how has that affected the situation of opening back of the economy and the social protocols associated with going back to work and stuff like that?
Again, with the numbers coming down, the economy has been progressively opening. We've had restaurants, pubs being opened back. We're doing more and more face-to-face consultations in the NHS. So there's been a gradual reopening of the economy, step by step, sector by sector, ensuring that there has been no corresponding large spike in the COVID numbers.
Okay. I noticed that in the news it was reported that there are restrictions in the UK for outsiders traveling to the UK with certain vaccines. Are you aware of that?
I've heard the same on the news. I think it's part of the initiative to ensure that people who come into the UK, they don't bring other variants in, and they themselves aren't exposed to the variants that are already in the UK, to which their vaccine may not have full protection.
Okay, but how do they determine that? How do they discriminate among these WHO-approved vaccines?
It's entirely based on the efficacy of the vaccine.
Okay.
So Moderna, Pfizer, AstraZeneca are extremely high efficacy vaccines, which are the ones that we use here in the UK. Okay. Their efficacies are above 80, almost into 90% efficient at preventing severe COVID.
Okay, so those vaccines are basically okay to travel into the UK?
Yeah.
Yes. What about you, Doctor? You are a Trinidadian. I know you served in the local situation for some time. You served there as a medical practitioner and you were in the hospital system, were you?
I did. I was a national scholarship winner, spent my formative medical career years in Trinidad, left in 2013, and got into a specialty training program here in the UK. And I'm now consultant in the neurology department.
You were a graduate of the University of the West Indies Medical School?
I was, St. Augustine campus.
Yes.
The class of 2006.
Okay, and you, that was my time. So you would have
It was?
Yeah, it would have been around my time. And you then went to the UK in a specialist program, neurology, and you have since stayed there. Have you tried to come back to Trinidad to make a contribution here?
Of course, I've tried a number of times. Trinidad is where, as we said, is where my navel string is buried. So it is my country. I always want to come back. Unfortunately, it's not been possible despite many, many interviews and attempts to get back to Trinidad.
Okay. That is kind of sad because we have a problem here. You know, we've been producing 5,000 graduates a year since about 2002, not just from the University of the West Indies, but from the tertiary system. And a significant number of them have become frustrated and left and gone abroad, got opportunities. Like you, we love when Trinidadians go abroad and they get better educated and they get better exposure, deeper experience, and they develop a wider scope for whatever their profession might be. But it would be great if after doing that they could come back home to Trinidad and serve the country in a constructive way, and we hope that that works out for you. I hope the Minister of Health is listening, or he will get to find out about this conversation, and that he might get in contact with you to see whether the public service system can accommodate you here, because I think that you would be of great value to Trinidad and Tobago. What is some of the kind of work that you are doing now in the hospital where you are at?
Well, I'm a consultant neurologist. So in terms of neurology, Sheffield is one of the largest hospitals in the UK. We are almost 40 strong as a neurology body. We encompass all of the subspecialties in neurology, so stroke, Parkinson's, memory problems, epilepsy. So our role, or my role really, is in the Parkinson's clinic. We manage people with medications, select those for surgical interventions, including in epilepsy, look after epileptic patients, sleep disorders. So it's an entire gamut of neurology that we practice here in Sheffield.
Yeah, well, you know, we have an aging population in Trinidad and Tobago. The lifespan in the country is about 73 years now. It is anticipated that over a relatively short period of time, that will move to about 83, 85 years of age. And of course, all of those things that you mentioned become issues as you age. So I would think that there would be a reasonable role for you here in the country, given the aging population. And I would think that if we could establish some kind of silver economy in Trinidad and Tobago and have tourism built around that silver economy, then some of the issues that you deal with could even expand beyond the Trinidad and Tobago population on these shores. You think that's a prospect if you got the opportunity?
I would agree with you. And Trinidad and Tobago has many talented sons and daughters in the UK who would all be happy to come back and share all of our skills that we've acquired in these places with the people of Trinidad and Tobago if we are given the opportunity. I know many of them in the UK.
As a person outside, and you are in touch with some of these people, you think that there is a burning desire among people who live abroad to come back home and contribute rather than stay abroad and be what you might call expatriate, basically diaspora people? Is there a burning desire to come back home?
There is. Trinidad and Tobago is where we grew up. It is our home. And we would all relish the chance to come back and contribute and build, because we've come out and we've seen what can happen. We've seen what we've left, and we know how we can improve things.
Yes. Yeah, well, on this program, over the course of the weeks that I'm here, I'm going to try to be in touch every week with at least one person in the diaspora, North America, the UK, elsewhere, because we have people all over the world. And we are going to try to see what kind of talent we have abroad and whether we are making best use in terms of developmental strategy for Trinidad and Tobago, because I think that this is a missing ingredient for us. But let's get back to this COVID situation. The Prime Minister is going to talk soon about what is likely to be the way going forward in the UK. Do you have any idea what, I know you can't be in his mind, but do you have any idea what are the challenges in the UK situation that now need to be overcome, both from the health point of view and the impact of health on other sectors in the economy?
Well, in terms of going forward, I think the Prime Minister wants to open as much of the economy as he can and balance that with the risk of people getting severe COVID and ending up in hospital and not only dying, but getting the complications of COVID, what we term as long COVID here in the UK. So in terms of going forward, I suspect that the restrictions will continually be lifted in large parts, but certain things, wearing of face.
Yeah, we're having some difficulty there with the connection. I've lost the voice.
Sorry, can you hear me now?
Yes, that's better.
The Prime Minister
You were saying that he wants to open up as much as possible without risking the possibility of increased numbers of infected.
Would still face masks.
Could we correct that? Is that possible? Is it possible to correct that?
Hello?
Yes.
Yes, sorry. So I was saying that he would try to maintain social distancing rules, some degree of face mask wearing, home working.
Could you put the doctor full screen? Yeah, go ahead. Yeah.
These things will try to balance the risk and the benefit. We all know that the longer the economy stays closed, the population becomes poorer, and lower socioeconomic status has a negative impact on a person's health, not just from COVID, but from everything else, from heart disease, cancer. So we need to find that right balance, that living with COVID, if you will, where you can ensure that all of the other health conditions are dealt with, but the risk of COVID is mitigated as much as possible.
Mm-hmm. What is I get the feeling that the COVID period, I mean, from all the information that we have, has really been a period of extraordinary transformation of businesses, technology, the way we organize society, out of necessity, because we could not socialize and engage in the same way as before. What has been happening in the medical profession because of COVID? You hinted at going back now to face-to-face patient care, and a lot of that became electronic communication with the patient during COVID as you tried to protect one another. But what is happening in terms of medicine, the technology, and patient care in the UK now? And how do you see it evolving as we move out of COVID?
We're going to be Hello? Yes. Right. I was saying that we are going to be a bit more selective face-to-face, at least in of patients that definitely need to be seen in person, that you cannot manage without doing so. But there are also certain subsets of patients that you can see over video and get the same information that you would with a face-to-face interview. So in terms of medicine, I think we're going to see the introduction of a lot more technology where we see patients, where appropriate, in their own homes or using video connections to try and minimize the burden of having patients come to hospital and keeping them safe and ensuring that they get the care that they need. Now, obviously, there are things like surgical procedures or physical examinations that you can't do over the telephone. And we have put in place systems where patients who come in are screened to ensure that they don't bring COVID into hospital with them. They don't put other patients and staff at risk. And because of things, for example, like surgical procedures where you need to be put on a ventilator, and being put on a ventilator puts you at a really high risk for elective procedure like a hernia repair of COVID, we need to find ways of protecting these patients, which we have already done.
Okay. Well, I want to thank you for agreeing to come on the program. It really has been a joy to do this interview with you and to learn what is happening in the UK and to have an overview. It was also important to learn about your own personal situation and the fact that people like you and others in the diaspora are very highly educated, very well exposed internationally, would like to come back home and make a contribution. And I want to thank you for talking to me. I hope that on another occasion you'd be willing to be interviewed again. Thank you so much, Dr. Mohan, for being a guest this morning on Brighter Morning with Bhoe. Have a great day.
Me?
Okay. And to all of you, listeners and viewers, I want to thank you very much for being part of the program this morning, Brighter Morning with Bhoe. I want to give you some numbers which you can call in tomorrow in order to be part of the program. We had no call-ins today, but tomorrow we would want you to call in. And those numbers are 609-6283, 609-6283, write it down, and 609-6284. 609-6284. Okay? 609-6283, 609-6284. And you can call in the morning and we will talk about issues in Trinidad and Tobago and whatever else in your mind is on your mind. I want to let you know that we have a call now. Okay. No? Okay, so we had a call, but it's cut off. I just want to let you know what's happening tomorrow. Tomorrow we will have Dr. Justin Ram, who is an economist based in Barbados. He's a Trinidadian, though, who has lived abroad for many years. He has worked with the mayor's office in London for about 10 years. Prior coming back to the Caribbean, he was up to recently at the Caribbean Development Bank. So we will talk about issues of the economy in the Caribbean region. And we will also have tomorrow Dr. Randy Sipasad from the University of the West Indies, who is a criminologist. And we'll talk a little bit about crime, the state of emergency, the impact on the crime situation, what trends are taking place. He, together with some colleagues, just wrote a paper on crime in Trinidad and Tobago and the Caribbean. So we will join him to talk about crime. So on tomorrow, we'll talk about the regional economy and we'll talk about crime. Thank you very much for being with me during these 2 hours of Brighter Morning with Bhoe. See you in the morning at 6 a.m. Thank you very much.